Today we are going to learn about brachial plexus. Brachial plexus is a plexus of nerve formed by anterior rami of lower forecervical and first thoracic spinal nerve. It has components that are roots. This is formed by C5, C6, C7, C8 and T1. Anterior rami of lower forecervical and first thoracic spinal nerve. This gives roots. Then upper two will combine to form upper trunk. Middle one continues as middle trunk. Lower two combines as lower trunk. Each trunk will divide into anterior and posterior. These are roots. It is trunk. Now division anterior, posterior. Now this anterior division of upper and middle trunk combines to form lateral cord. Anterior division of lower trunk continues as medial cord, and posterior division of all three will combine to form posterior cord. Lateral cord, posterior cord, medial cord. Lateral cord is formed by anterior division of upper and middle trunk. Posterior division of all three trunks forms posterior cord. Anterior division of lower trunk forms medial cord. This is very easy method to draw brachial plexus. Roots, then upper two combines form upper cord. This one will continue as middle trunk. This two will combines to form lower trunk. Each will divide, and anterior division of upper and middle trunk combines to form lateral cord. Posterior division of all trunk will combine to form posterior cord. Anterior division of lower trunk continues as medial cord. Okay. Now we will study branches of brachial plexus. Again, we'll revise once again. Roots from C5, C6, C7, C8, T1. Upper two will combines to form upper trunk. Middle one will continue as middle trunk, lower trunk. Anterior division of upper two trunks combines to form lateral cord. Posterior division of all three trunks combines to form posterior cord, and the anterior division of lower cord continues as medial cord. Now branches. Branches will arise from each part of this brachial plexus. Branches from root. Root one is dorsal scapular. Dorsal scapular root value C5. This arises from here to the root. Dorsal scapular C5. Long thoracic nerve, which supplies serratus. C5, C6, C7. Root value of long thoracic nerve. Paralysis to the long thoracic nerve leads to winging of scapula from trunk. This is trunk. From trunk, two nerves. Suprascapular nerve to subclavius. This C5 and C6 will combine and form upper trunk. This nerve arises from the upper trunk, should have root value of C5 and C6. Suprascapular nerve to subclavius. Division has no branches. Now branches from cord. From lateral cord. It has 3 branches. We can remember it through the LM, that is lateral pectoral nerve, lateral branch of median nerve, and musculocutaneous nerve, L and M. Musculocutaneous nerve, lateral pectoral nerve, lateral branch of median nerve, musculocutaneous nerve, that is from lateral cord. Now from medial cord, we can remember through 4MU, that is medial pectoral nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, medial branch of median nerve, and ulnar nerve. This medial cord arises from combination of C8 and T1, because C8 and T1 combines to form lower trunk. Anterior division of lower trunk gives this medial cord. So the root value of all the nerves which are arises from medial cord should have the root value of C8 and T1, but exceptionally ulnar has C7, C8 and T1. This is one exception. Rest all C8 and T1. Now posterior cord. We can remember it through ulnar, mnemonic UL, NER, U, upper subscapular nerve with the root value of C5, C6, lower subscapular nerve with the root value of C5, C6, and thoracodorsal nerve or nerve to latissimus dorsi, upper subscapular nerve, lower subscapular nerve. This is thoracodorsal nerve, also known as nerve to latissimus dorsi, with a root value of C6, C8. A denotes axillary nerve with a root value of C5, C6. Radial nerve, which includes all nerve, that root value is C5 to T1. We can remember it through the mnemonic called ulnar. Root, trunk, division, cords and branches, and these are mnemonic to remember. And lateral cord has root value of C5, C7 for all 3 nerves. Medial cord has C8 and T1, exceptional ulnar. And posterior cord, these are different. We should remember each one separate.